Welcome to the Taylor Method for Pain-Free Living, a podcast that features enlightening conversations with experts in the medical field that helps to improve the health and well-being of those suffering from chronic pain due to injury. Learn from leading authorities the questions you should be asking to experience pain-free living. Hosted by father and son, Dr. Derek Taylor and Dr. Hudson Taylor, and joined by industry professionals in the health field, including doctors of integrative medicine and personal injury attorneys. Enjoy well-rounded and informative conversations to help you get out of pain while achieving optimal wellness. Dr. Derek Taylor and Dr. Hudson Taylor are the doctors of Taylor Chiropractic and Laser Center in Florida and California. Both father and son duo have earned respect and a solid reputation for successfully helping people transform their lives by assisting them to discover the hidden causes of their painful health challenges, leading them to experience the resolution of their problems using the Taylor Method. Tune in each week to learn about the Taylor Method, Dr. Taylor's proprietary technology that looks at the whole person and identifies the root cause of pain while facilitating natural healing and helps to restore the body to optimal wellness without using drug injections or surgery.
Well, welcome to the Taylor Method for Pain-Free Living. This is Dr. Derek Taylor. I'm here with my guest, Dr. Christopher Hickey, molecular biologist and founder of what was that again? The founder of what?
Founder and president of Cancer Consultants of America.
Founder and president of Cancer Consultants of America. Dr. Hickey, welcome to the show.
Thank you. It's a pleasure to be here. Thank you for having me.
Yeah, well, it's great to have you. We had met a little while back, and I thought how fascinating what you do here as a doctor and helping people and being there an advocate for them as they are navigating and walking through the process of dealing with cancer. And I just thought, wow, this is fascinating. I think what you do is so amazing. And I just said, people got to know about this. So why don't you tell us a little bit more about your background, how you got into this, and let's start with that.
Sure. And thank you for taking an interest in Cancer Consultants of America. My background, I earned my PhD at The Ohio State University, specializing in leukemia experimental therapeutics. Following my time in my graduate studies, I did a postdoctoral fellowship at the Mitchell Cancer Institute, where I investigated breast cancer experimental therapeutics. So my background is liquid tumors as well as solid tumors. And in doing so, I took an interest in developing novel cancer therapeutics. And with that being said, my background is pretty diverse as far as different types of cancer. With that being said, I felt that I had something to offer as far as cancer education. Oftentimes, clients and their families, they'll receive a cancer diagnosis and they have a lot of questions. And unfortunately, there's not many people around to answer these questions. And that's where Cancer Consultants of America comes in. And with a cancer molecular biology background, I have the insight to provide that information for those clients and their families.
Yeah. Wow. Okay. And what led you into this field? Personally, how did you
it was more of a calling, really. It was even as a kid, I wanted to be a scientist, and then it was during my undergraduate career that I decided to do molecular biology. And then in graduate school, it was my calling was cancer molecular biology. And so it was just kind of going down that rabbit hole, and that's where I ended up.
Yeah. Well, what are some of the common challenges you see your patients experience when they first get the diagnosis of cancer? First of all, I'm sure they're often, it's like the rug was swept right underneath them. It comes as a surprise for many of them. And what are some of the challenges that they face when they first hear this diagnosis that they have cancer?
Challenges are plentiful, unfortunately. The biggest thing is what's going to happen. It's the fear of the unknown. And with fear of the unknown, there's a lot of questions. And there's not a lot of resources available to these clients and their families to get answers to these questions. And that's where the Cancer Consultants of America comes in, provides cancer education. And oftentimes there'll be a lot of medical terminology that is difficult to understand. So what I'm able to do is to take a look at that medical terminology and interpret it and convey that information to them in a language that can be understood.
So these patients will start to hear all this medical terminology and jargon that they're hearing from their medical doctor, but they have no idea what does that mean? Oh, they'll get an MRI or CT scan report. Well, what does this say? Or a blood test result, and what does this mean? And most of the time they'll just start going on Google, right? And they'll start Googling things. And what's the pitfalls of that? Just jumping on Google and trying to figure this out yourself. I'm sure there's some benefits to it as they're getting information, but what are some of maybe the pitfalls that they're not foreseeing or they're not aware of?
Yeah, the drawbacks for doing online searches is just the understanding. And while they may get some of the information that's going to be relevant, there's a lot of information out there, and trying to pinpoint the correct and accurate information to their diagnosis is the challenge. And with that being said, where Cancer Consultants of America come in is to accurately report back to them the information and give them insight as to what they're dealing with on their cancer journey.
Mm-hmm. And so what are the common, do you see some common causes of, there's so many different types of cancer out there. Are there some common denominators that you see that has brought about this diagnosis in the first place?
Common cause I see would be lifestyle. Oftentimes it's going to be lifestyle, and with that being said, changes can be made to lifestyle to improve the health.
Mm-hmm. So what are some of the lifestyle habits or lack of habits that I should say that are common, commonly seen with your patients?
Often it's going to be diet and activity. And unfortunately, there's a preponderance of just a sedentary lifestyle. And so it's good to get out and be active. And being here in South Florida, weather's really nice. We have the opportunity to get out and be active. Diet is really important as well. We are what we eat. And the food that we put in, right, has an impact on our overall health.
Mm-hmm. Yeah, so I thought this was fascinating here, you dealing with this, because there's some people that don't know that my first wife was diagnosed with cancer at age 29. Now she ate a really clean, all organic diet, and she worked out 6 days a week. She taught aerobics. She was constantly working out, and she never smoked or drank, and everybody thought she was going to live to 100. But in her case, she was diagnosed with an anaplastic astrocytoma grade 3 at age 29. We had 3 small children. So in this case, it wasn't diet so much, and maybe there's some, if you dug a little deeper, maybe there's some things that could have been there, missing nutrients in the diet and whatnot. But she diet and exercise was the case. So what are some other underlying causes other than diet and movement or physical activity that you see that people are not aware of that could be contributing to cancer?
Could be the genetics as well. And with the genetic background, there is a link to family history and cancer development. So genetics plays a strong component in our overall health.
What about so if somebody does have a genetic predisposition, oh wow, colon cancer has been running in our family for eons, or it might not even be cancer, it could be heart disease, or it could be if somebody knows they have a genetic predisposition in a family history, what advice would you give them? Are those things that genetic manifestation of that disease can be slowed down, or it's not like it's not like a sure thing they're going to get that regardless, right? There's some things that they can do to be working towards that. So can you speak on that a little bit?
Yeah, so the genetic component would be a predisposition. It doesn't necessarily suggest that that person will experience a cancer journey. However, it is it's a wake-up signal, and it allows them to experience routine monitoring and observations. And we have a lot of a lot of techniques that are available to monitor any predispositions that someone might have.
Mm-hmm. Yeah. And so somebody gets this diagnosis, they give you a call. How does that work out? What do you typically do when somebody first starts with seeking your help and helping them?
So often I'll get a phone call, and either it'll be a future client or a family member, and we'll have a conversation. It all begins with a conversation, and it's a willingness on their end to want to know more. A lot of times it takes a while to get mentally prepared to face this challenge. So with that being said, it's a willingness for them to make that phone call. Now, once they make that phone call, we can talk, and I could get an idea of their current condition. I could get an idea of what they hope to achieve from including Cancer Consultants of America into their circle of care. Mm-hmm. So then what we do next is we meet, and I review their situation, and every situation is unique. And so I'm able to either meet with them and or their family and kind of assess the situation. Where are we now? Where have we been? And where do you want to go? And that's how the journey begins. It's through a conversation. And in some cases, the cancer, it's more of a relatively common cancer. In other cases, it's a relatively unknown, rare cancer. In either way, the amount of work that I put in is significant and beneficial to the client and their family.
Right. And certain cancers are going to respond differently to different therapeutics, correct? And so they may get a recommendation from their doctor, and you can say, yes, there's a 90% success rate using this means of treating the cancer. And other times they may make a recommendation, and there's a low percentage of that being helpful, but there's another option that would be better. So that's basically what you're doing, right? Helping them process the information that's given to them by their primary doctor or their oncologist, and helping them. You're like a sounding board, would be my guess, in helping them walk through some of these choices that they need to make. Is that correct?
Yeah, exactly right. Exactly right. As a cancer molecular biologist, I have the understanding on how certain therapies work. So if a client is given 3 options for the treatment of the cancer, I could explain to them in great detail as far as the molecular mechanisms on how these therapeutics will work. So that's the cancer education component that's offered through Cancer Consultants of America. Another component that's offered is medical liaison services, and where I will physically go with the client to their medical appointment. Now, when we're at that medical appointment, we have the option. Either I can ask relevant questions on their behalf, or I can even just be a fly on the wall and just listen. And then after the appointment, we can meet. Oftentimes it's meet for coffee. I can explain in detail what happened, and then interpret some of the findings from that appointment.
And I just think that's so invaluable, because they're sitting there with an oncologist who's devoted his entire life to cancer and what they're treating, and it's treated hundreds or maybe even more patients this type, but this is their first time going through this. They're not even knowing which questions to ask, right? And so
Exactly.
you coming with your background and knowledge, you're able to ask the right questions, and then afterwards you're able to process that with them and to help them think through that and say, hey, you're giving them information so they can make the best choice that they feel that resonates with them and they feel is going to be they're most comfortable with, correct?
Yes, that's correct.
So can you give me an example of a patient that you've had maybe recently that this is, how this works, and an example of what you're just talking about here?
Yeah, sure. I have on my website, cancerconsultantsofamerica.com, I have testimonials that are available for your listeners to check out. One testimonial that comes out to me was a medical liaison occurrence, in which I went with a client to medical appointment, and blood work was being done, and trying to identify if ovarian cancer was present or not. And the diagnostic tests that were run, they were good. However, there's other tests that are available that could provide more information for more insightful diagnosis. And so during that medical appointment, I brought it up and said, have you considered doing this specific diagnostic test? And the oncologist was very receptive and paused for a moment and said, you know what, that's a pretty good idea. Let's see if that's available. And we proceeded forward. Now, fortunately for that client, it was not a diagnosis of ovarian cancer, which is very, very fortunate. But that's just one example of how medical liaison services are available. And when a client gets a cancer diagnosis and starts a cancer journey, there's a lot of questions. And on top of those questions, one of the challenges is they need answers, and they don't even know what relevant questions to ask. And there's not many cancer molecular biologists available to work with them and walk side by side with them on this cancer journey. And that's where Cancer Consultants of America comes in, provides education, and will walk step by step through this cancer journey with them.
And I see that's invaluable. I mean, you run a blood test like that, and you can help. You can maybe see from the blood test doing something much less invasive than, let's say, like a biopsy, right?
Correct.
And you could have saved them a ton of heartache and procedures just by asking the right questions and running the right blood test, which is, I think, would always be one of your first go-tos, right? But oftentimes the insurance companies this is their standard of care, but it's not about doing the standard commoditized standard of care, because that often has a lot of more holes in it than a block of Swiss cheese, right? There's so many, there could be other tests that they could be running that are more effective and efficient, but the insurance company doesn't pay for it. And so the doctor's not ordering it, right? Or this is how we've always done it in our training. And so this is how we're going to do things. So I think that itself is worth its weight in gold. And on this topic, can you talk a little bit and educate our patients about about biopsies and what happens when you're not sure if something's benign or malignant, if it's non-cancerous or cancerous, and a biopsy is performed? A lot of people don't understand the concept of what happens when a biopsy is done. Can you speak on that topic?
Sure. Yeah. So what a biopsy is an analysis of the tissue in question. And what this allows to happen is a more insightful characterization of the tissue in question. In doing so, able to identify cell morphology, the cell arrangement, if there's any certain proteins that are present. All right, all of these bits of information are really important because it provides insight as far as the characterization of the tumor, but also allows for opportunities. If a certain protein is being expressed, that protein could be a receptor for a certain molecular therapy. And that's going to allow to serve as a gateway, if you will, for the treatment of that cancer.
Yes. And so what happens though when you open a tumor up and you do a biopsy? What are some of the potential risks if you do that prematurely without, let's say, exhausting the blood work route?
Yeah, so there's certainly disadvantages for that. But that being said, it's always best to try to avoid any invasive procedures if possible. However, if characterization does need to happen, then a biopsy procedure can provide some insight. However, there's certain advantages and disadvantages to that. One that comes to mind would be dislodging the tumor mass, and that could be a real concern.
And what's the concern about that when you dislodge a tumor mass?
Well, it's in doing so, you'll know where it's going to go. Right, and it's difficult to contain, and that's a significant concern.
Right, and so with that said, there's also things you can do, like you can do CT scans, right, or PET scans. You can do PET scans if something, to try to determine if something is cancerous or malignant.
Yeah, that's correct. So there are many options that are available for non-invasive procedures in order to characterize the mass. And some of those, as you mentioned, CT, PET scans, and there are methods available to characterize as far as the metabolic rate of the cells, of the tumors. And in doing so, you can look at the metabolism of the mass in question, and in doing so, you can identify and localize where that mass is.
Mm-hmm. Yes. Well, are there anything else that you'd like to speak on in regards to what you offer in Cancer Consultants of America in regards to patients going through this?
Yeah, often a couple of things I want to point out is that assessing the value. What type of value do clients and their families place on knowing everything there is to know about the cancer diagnosis? I mean, that information is invaluable, and it doesn't happen often, for clients or patients. So in doing so, gather as much information as possible. And at Cancer Consultants of America, we offer that cancer education, and we can explain any therapies and treatment options that are available. Also, we can provide insight as far as clinical trials, if that is something that is of interest to the client. And so we have a database that is available and searchable, and we can find the location where in the country that clinical trial is, and make that connection as well. So cancer education, know what you're dealing with and know as soon as possible. And then next would be the medical liaison service. If you're going into a cancer journey, it's best to take somebody with you who knows cancer and is an advocate for you. And then finally, the third service that's available at Cancer Consultants of America is information sessions. So oftentimes I'll get requests to speak about a particular cancer of interest, and I can hold a public information session about that particular cancer, and almost like a lecture-based type of presentation. Very informative.
And what are the types of cancers that do you specialize in certain types of cancers, or ones that you work more closely with, or is it just all cancers in general?
Yeah, so my specialty is leukemia. My subspecialty is breast cancer. However, have a diverse background in cancer, including but not limited to skin cancer, prostate cancer, colon cancer, breast cancer, ovarian cancer. So as you can see, it's the background is plentiful.
Right. And then do you talk about treatment options, both conventional and alternative?
Yes, right. So
let them choose.
we can have those discussions as well, as far as conventional and alternative treatment options, as well as clinical trials and what's out there, and if that might be of interest for the client.
Great. Well, how can our patients, clients, or people listening to the show get a hold of you if they wanted to ask you some questions on the phone or inquire more about your services?
Sure. The website is available. It's www.cancerconsultantsofamerica.com. We also have a social media presence. You can find us on Facebook, Instagram, LinkedIn, and Twitter. And also the phone number is area code 561-252-3090.
Great. Well, you've been on the show with Dr. Christopher Hickey, molecular biologist, founder and president of Cancer Consultants of America. It's been a fascinating show. I think it's been eye-opening for some people. It's nice to know that if you are going through a trial or a difficult time such as this and dealing with a cancer, and you would like somebody in your corner who's specializes in this and can help you with working through some of these issues that you're facing, or you just have any questions about, I guess they can call you for anything, right?
Absolutely.
Give Dr. Hickey a call. As you heard him here on the show, he can help point you in the right direction, and it's just a comfort knowing that your services are even available. It's a pretty scary time for a lot of people. So thank you so much for being on the show. It's been great having you, and we'll look forward to seeing you helping more people here in the future, and helping people with this this challenge that they face at this time. Cancer is so prevalent in our society. It just seems like more and more people are coming down with the diagnosis. I think it's more prevalent now than it was 50 years ago, 20 years ago, 10 years, even 5 years ago, right? I mean, it seems like to be on the rise, and just having your services. I mean, where these challenges arise, there's people like Dr. Hickey that come in and are able to help people with this. So thank you so much for your time. It's been great having you on the show.
Thank you for having me.
Thank you for listening to the Taylor Method for Pain-Free Living podcast. For more information about the Taylor Method and how you can find lasting pain relief, visit www.drderektaylor.com. That's www.drderektaylor.com.